Hello everyone, I'm Graham from NEET Force Media. We are here at CPAC interviewing this author. Tell us who you are and what you're working on.
Dr. Conti, I'm a physician. My specialty is emergency medicine. I'm also a author of a conservative novel.
You mentioned that you're a doctor. Everyone right now is paying attention to the coronavirus. And so do you want to give us your perspective on what you see as the severity of this sort of outbreak?
All right, first off, I think we need to keep everything in perspective. Fear never accomplishes anything. If anybody tells you they definitely know what's going to be happening in the next month, 2-3 months, they're lying. It's that simple. This thing could just blow over in a month or two, or it could explode in a month or two. Nobody really knows what's going to happen. But again, to put things in perspective, right now I think there's somewhere around 100 cases of the coronavirus in the United States, and I think there may have been one death. All right, compared to the average flu, we're in flu season right now. 100 people in the United States alone die from the flu every day. 100 people in the United States alone die from the flu every day. So that puts things in a little bit of perspective.
Based on what we have seen in terms of the spread across the world since about mid-January, is it fair to say that this coronavirus that we should expect it to reach our neighborhoods, our hometowns at some point? What do you think is the best? One, do you think that is true? And two, what do you think is the best way to prepare for such a thing?
Again, this would be an opinion because we can't predict the future. All I can say is be prepared. This Boy Scout motto. Remember, doctors and nurses, we're patients too, okay? And so what we've done around my household, and you probably have heard this on TV already, but it's true. Wash your hands, soap and water. Keep your hands away from your face. Use the alcohol swabs or liquid to keep your hands clean. And stay, if you can, avoid major crowds, big cities, that kind of thing. And if you can, preventively, see if you can pick up an Nancy 95 mask or higher. Okay. Right now, my wife and I and my family, we're not using it, but again, be prepared. The last thing, and I haven't heard this discussed very much, is you want to boost your immune system. If your immune system is in the toilet, it doesn't make any difference. You're going to get hit with the flu, pneumonia, whatever, because right now we're in the middle of flu season, and in the emergency room where I practice, we're seeing a lot of flu cases, pneumonia, exacerbation of COPD, and what have you, okay? And the thing is, all you can do, again, is be prepared. So if you can boost your immune system, everything boils down to the immune system, you may be able to avoid this virus, or if you do get it, it'll be a mild case. It does. I'm sure most of you have heard of Ebola virus attacks African village. 98% of people die in 2.5 nanoseconds. Okay, great. Now what about the 2% that are walking around afterwards going, and what else you want to hit me with? In other words, what is it about their immune system? There are people out there you can inject with hepatitis. They don't get hepatitis. Obviously their immune system regarding hepatitis is very strong. We don't know, okay, each of us, where are strong and weak areas in our immune system. Some people have very strong lungs regarding the immune system. Other people have strong immune systems regarding their kidneys. Unfortunately, a lot of times you don't know until you get hit with something. But the point is, boost your immune system as much as you can, which boils down to probiotics, because 70-75% of your immune system starts in your gut. Remember that. Your immune system, which is your defense system for your body. Think of little soldiers being built, and they run after bacteria, viruses, cancer cells, and destroy them. But that system is, those little Terminator soldiers start getting built in your gut. Think of like an assembly line for cars. The first part of the car is the frame. If the frame is bent, I don't care what kind of wheels, engine, transmission, you've got a lousy car. So prep your gut best you can with good probiotics and good food supply and fluids.
Just continuing on the train of thought of the immune system, would you recommend to people to get as much sleep as they possibly can?
Proper sleep, yeah.
Right, to get as much nutrition.
Absolutely.
Good nutrition that they can get.
Absolutely.
And for people who are very busy, what kind of exercise would you recommend for them? Sort of light, half an hour every day kind of thing?
Yeah, again, discuss it with your doctor, but you want to get in probably about a good 20 to 30 minutes of good aerobic type exercise minimum a day. You just have to find the time to do it.
Shifting topics. Recently, there was an opinion column in the Washington Post. I think the author was Helene Olin, and she basically wrote that the coronavirus, as it is spreading around the world, is very good evidence for the case that we need universal health care here in the United States. And I also remember President Trump, well, then candidate Trump, on the campaign trail in 2016, saying that after he takes office that we will have near universal health care and everybody is going to be happy with their plan. What is your view on our healthcare system? Would you agree that it is very broken and that it needs to be, at the very least, repaired?
All right, that's a multi-sided question.
Sure.
First off, I don't see where the universal health care has anything to do with the coronavirus. Those are two entirely different topics.
Sure.
My feel regarding universal health care is that name for me, where it works efficiently. So please don't tell me, Denmark and the Nordic countries, because it has not worked there efficiently. Well, let me put it this way. It does work fairly well as long as you're willing to pay a 60% tax rate. See, the thing is with a lot of the liberals in the left is they give you a half a truth. And what is a half a truth but a lie? So yeah, you'll cover everybody for 60% tax rate. The other thing is, what they'll find in universal health care is there's going to be restrictions. They don't tell you that. In that what will happen is, okay, you're 65 years old, you need stents, sorry, you're too old. Oh, you're 70 years old and you need dialysis for your kidneys, sorry, you're too old. They don't tell you that. There has to be restrictions. It's not going to be unlimited freebie care for everybody. What I'd like to ask Bernie Sanders and those other Democrats is, I would say, universal health care, Bernie, sounds great. I'm going to sign on the dotted line right after you do. Because you're going to have the same program as us peons, right, Bernie? You really think the people at the top are going to have the same peon program as everybody else?
So advocates for Bernie's plan, the Medicare for All, would say that we already spend around $800 billion a year on our current system and to outcomes that are worse than the rest of the world. They would also say that we're the United States of America, so if you ask me, name us a country that does it as good, well, they would say to you, I'm an idealist. And the pioneering American spirit can achieve this brand new system better than any other country would. And lastly, they might say that we have aspects of socialism in our country already, right? Like we don't have private fire departments, we don't have private police forces, and we don't have private militaries, at least within, the bounds of domestic United States. What they would also say is, if our current healthcare market operates on a profit motive, doesn't it make sense to at least have a government floor in the healthcare market to provide competition to the rest of companies, especially the insurance companies, who oftentimes operate on the model of fraud, right? Like, I'm sure that you've heard of this, where it's like, oh, hey, insurance company, like, I need to be treated now, and then they say over the phone, oh yeah, like we're glad that you paid us all those payments every month, but now we're going to deny you care every step of the way. So what's your take on those who say that our system is very broken as it is, and some level of government intervention in the market is needed at this point?
All right, first off, I totally agree that the healthcare system is broken and it's getting worse. But I don't think the answer can come from the federal government. I think that my personal take is, first of all, show me in the Constitution where it has health care. Show me in the Constitution where education is required. It's not in there. There's a reason. Our founding fathers knew that if you institute those things with education and health care, it's going to lead to graft and corruption. And there's a lot of it going on right now. My personal take is you drop it down to the lowest possible entity, the states, possibly the counties. Let them offer, through insurance companies, competition. So people who are working have a choice of what they want. Now, the people that are indigent or can't afford health care or disabled or whatever, they're put into a pool, like a car insurance, like a high-risk pool, in which all the citizens of that county or possibly the state would pay into that high-risk pool. If your state has more people on disability and uninsured people and that involved, that your state's going to have to pick up more of the tab through each individual taxpayer. So be it. That's my take on it. But having the federal government run the show, the higher up we always go to allow government to take care of things, you only have more graft and corruption. Those of you who even have a, what do they call it? The home
care,
like in your local community. Local home councils and things like that. There's corruption. Then you go up to the county level, more corruption. State, more federal government, more corruption. You want to give it to the federal government to run? Don't think so.
Right. I mean, just to what you were saying earlier, my response would be like in our founding documents, one of the three principles of our country is life, liberty, and the pursuit of happiness. I mean, I would say that healthcare is under the jurisdiction of life. But segueing to what President Trump promised us on the 2016 campaign trail, one of the things he also mentioned was that he was going to eliminate the arbitrary lines around the states when it came to healthcare providers being able to compete with each other. Are you like in agreement with me that we are still waiting for President Trump to take action on that promise?
Yes. I'd like to see competition. Free enterprise always works best, but you have to have free enterprise.
I appreciate your perspective on that topic. Do you want to tell us about your books? Do you want to take us on a little bit of a synopsis on book 1, 2, and 3?
Basically, this is totally non-medical what I wrote. I decided to write this book. It's a trilogy, although it's one continuous read from book 1 to 2 to 3. It's just one continuous read. The publisher said you need to break it up because you show somebody a book that's 4 inches thick and they flip out. So it's actually one continuous read. I wrote it as a novel because people like to be entertained.
Yeah.
However, I've written it as an educational read so that the reader is being educated while they're reading.
Yeah.
It explains, excuse me, the how and why this country has gotten to the mess we're in. Yes, Donald Trump is trying to move us forward in a positive direction, and I applaud him for that. However, most people really don't understand the problem or problems that got us into this situation to begin with. And if we don't understand the problem or problems that developed over the last 50, 60 years, how can we develop a solution? So that's what I discuss, the problem or problems in a very entertaining fashion that have gotten to this point, and how do we get out of it? I go through that too.
Do you want to take us through a synopsis of just healthcare? Because it seems like healthcare is something that you really understand, that you've lived working in this industry for quite a while. So would you be able to tell us like how our healthcare system became so broken, and in your view, what are a few things that we can do to get ourselves out of the mess that we're currently in?
Well, let me explain why sometimes things are so expensive right now. Okay, even some of my nurses, once they understand, it's very clear. Okay, for those people that are working and paying insurance premiums, and again, I'm paying insurance premiums. I'm a patient too. My wife's a patient too. Okay, paying $1,500 a month for insurance premiums.
Yeah.
Well, think of it this way: you go to the hospital and they're charging you $1,500, we'll say, for a CT scan. Use the ambulance. What it'll say depends on where you're located. $1,000 to go to the hospital by the ambulance. Now, unfortunately, people that are indigent or on basically your freebie program, many of them, I don't know what the exact percentage is, but it's a good number, take advantage of that. They literally will call an ambulance. We see this on a daily basis, not once a day, but pretty much all day long. They'll call an ambulance for a stubbed toe, sore throat, earache, whatever. Well, it's a free ride. Now do you understand why you're paying the $1,000 for the ambulance ride? Because you're paying for your ambulance ride plus all these other people that aren't paying for the ambulance ride. They'll come in and say, I want a CT scan. No, make that an MRI. Because they're not paying for it. Somebody's got to pay. So I order CT scans like water. So you're paying for that CT scan, but you're also paying for your CT scan plus all these other people that want a CT scan, and they're not going to be paying. Somebody's got it. You have to be held responsible. If you're talking about a level playing field here, they can literally come in 10,000 times, and some of them will say, I don't like the diagnosis. I'm going to go right out and sign in again. Or sometimes they've waited too long, we've drawn the labs, we've done x-rays, and we don't have everything back yet, and they just walk out. Now, if you have insurance, if you walk out, you get a little note from your insurance company saying, you know that $4,000 bill from the hospital, we ain't paying it because you didn't stay for the whole final diagnosis.
Okay.
This is not a level playing field.
Yeah. I remember, I think it was during the New York Times editorial board podcast that Tom Steyer gave his analysis of one reason why our healthcare system is so broken, and that is because mainly there's 4 interest groups lobbying for a better system for themselves, and those 4 interest groups were doctors, hospitals, insurance companies, and pharmaceutical companies.
I'd agree.
Yeah.
Again, there's a lot of corruption going on. But if you open it up to total free enterprise, the free enterprise system will work it out eventually. And again, those people that truly need the care, those people who are truly indigent, truly disabled, okay, they'll work it out so maybe there's some kind of a pool that they can be put in to get their health care. But the way the system is working now, it is not a level playing field. And the taxpayer who's paying massive insurance premiums every month is getting literally shafted. Our own nurses, I will say this, our own nurses won't use our own emergency room.
Interesting.
Why? Because they have to pay a $300 copay cash just to be seen by us doctors. And then they beg us, please don't order the CT scan, please don't order this test, because they're saying it's cha-ching, 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 cha-ching.
Yeah.
They know.
Yeah.
Because somebody's got to pay for all these other people that are not paying.
Yeah, to me, it seems like an incredibly broken system that absolutely needs to be fixed. We take Lyfts and Ubers all the time, and we always ask the driver, like, if there's one thing you could ask President Trump to do, what would it be? And overwhelmingly, they say to us, Mr. President, please fix our broken healthcare system. I have been uninsured. I've been without medical insurance for a long time, and personally, Elaine and I are part of this demographic. We've been without health insurance for quite a while.
I believe. Because it's too expensive. Because once you get it, you're paying for yourself and all these other people that are not paying. Somebody's got to pay. I'm going to make a statement that's going to really tick off the liberals and the left.
Sure.
Okay? And this is something that I also disagree with President Trump.
Sure.
Dr. Trump. And both sides have said this. We need to cover pre-existing conditions.
Interesting.
Now, on the surface, that sounds great.
Yeah.
But most pre-existing conditions, I'd say upwards close to 90%, are caused by the patient themselves. In other words, tell me it's only that 10, maybe 15% of people who are born with diabetes, born with a preponderance to have high blood pressure, born with congenital problems. That's a very small percentage. Most of the other people, they are their own cause of their own problem.
Yeah.
In other words, you have people that come in, they've been smoking their whole life. Well, they develop problems, maybe a cardiac stent, okay? And it's like, wait, whoa, excuse me. Why am I paying for your state? You're continuing to smoke.
Yeah.
So they cause their own pre-existing condition.
Mm-hmm.
Now, a lot of people are not going to like that, but it's the truth.
That's really interesting that you say that. Do you have an idea of where that statistic of 90%, where that comes from?
You can research out the number of people that are born with pre-existing conditions. That's it.
Okay.
You're born with it.
Yeah.
Or it develops over time.
Yeah.
I mean, yes, there are some people out there, they've taken a medication and developed pancreatitis. I understand that.
Sure.
Fine. But a lot of people out there develop pancreatitis because they have been drinking.
Yeah.
So, excuse me, I'm paying for your supposed pre-existing condition was caused by drinking? No, I want to cover the person who somehow was taking medications and developed pancreatitis. That's proper.
Yeah, I mean, what you said makes me really think that we need to transform our society even more than just at the level of healthcare, because I know that there are mothers who say that, hey, this is my child and my child is autistic and that is a pre-existing condition. I know that there are older folks who start...
It's understandable, absolutely.
Right.
Yet I have mothers with 2 and 3 month old infants in their arms, and the bottle in the mouth of the 3-month-old is cola covered. And I've asked them, well, what's in that bottle? Oh, cola. You will kill that child. Yeah, but he likes cola. That child's going to have a developmental delay at some point, and they're going to list it as a pre-existing condition.
Yeah, I think that the roles of ER doctors in our society, I see them very similar to firefighters, to police officers, to ambulance workers, in that your job every day is to witness the worst of humanity. People come to you when they are at one of the lowest points of their life, and I'm sure that many of my friends on the left would say, oh, well, this is totally a reason why we need government intervention in this market, because things are so dire in the situation of this market. When you start to put in pricing options, people are not going to be able to make the best decisions.
Most people don't realize this, and it depends on hospital to hospital, but close to 95% of patients that we see in our emergency room are repeaters. Less than 5% are people that come in for the first time. Ask yourself, how many times have you used an emergency room in your life?
Quite a few times.
Okay.
Yeah.
You must have some underlying condition.
I mean, it was one of those things at the time where I did not have regular health insurance, and because I wasn't able to get things checked out, when things got so bad, that's when we sort of freaked out and was like, okay, well, we can't put this off any longer. We have to go to the emergency room. And for me, I'm very lucky in that I've been a resident of California all of my life, and California has this program called Covered California, where they provide Medicare level insurance to every single state resident, but it's not something that's desirable, right? If I'm not going to the emergency room, and if I'm going to an actual provider, or if I'm going to a dentist, many of them will say to me, sorry, Graham, we don't take the state Medicare program at all. You're gonna have to pay us cash. So that's why, from my perspective, I think that there is room for government intervention in the healthcare market, because at the very least, if we set a floor, people are not going to want to use the floor if they have a better option available.
Unfortunately, you have a certain percentage of people that will abuse the system. And I think if you have some kind of government control, and I agree there does, but at the lowest possible level, where it's the state or county level.
Yeah.
But the higher up you go, the more confusing it gets, and the more graphic corruption gets set in place. Because we have people that will use the emergency room once a month, once every other month, once a week. And we see the same ones over. Did you get your prescription filled? No. We have people that come back 2 or 3 days later, same problem. And we'll go, well, did you get the prescription filled because you have the record?
Yeah.
No. Didn't get the prescription filled. It's like, what do we do?
I'm actually curious to hear your opinion on something I referred to earlier in terms of like, it seems that our problems are so systemic, like they go down so far down to the root that like even if we were to transform our healthcare system, we would still have all of these underlying problems with people not having their basic needs met. And what I'm referring to is that like when in 2016, I was able to spend a little bit of time with Native American communities, and one of the things they really taught me was that our society is sorely missing the aspect of the village, right? Like, ever since like post World War II, we've lived in this sort of like fantasy ideal of like, oh, the nuclear family, and the father and the mother are going to be able to take care of all of their children, whether it's 1, 2, 5, or 10, and what's been missing is like the grandparents and the uncles and the aunts, and like when you had that like sort of large extended family all living together in the same community, you were able to share knowledge and ideas and distribute the burden of cooking and cleaning and laundry and all of that stuff. I'm curious to hear your opinion on that perspective in terms of like what we need to fix more in our society rather than just the healthcare system.
Well, yeah, I agree with you totally. It boils down to family, and unfortunately, many families today are fractured. Again, the government encourages fracturing of the family.
Wow.
If you think about it, I mean, you have a lot of women out there. The government basically is the husband in absentia. Mm-hmm. It's upside down. Mm-hmm. It's upside down. Mm-hmm. We need to encourage the nuclear family, husband, wife, children. That the husband should be the leader of the house. I know this sounds very radical by today's standards, but it worked in the past, didn't it?
I mean, do you think that we as a society also need to encourage communities, especially extended family communities, to come together and operate on more than just the nuclear family level?
Yes. Again, years ago, before we had all this government regulation control, okay, if somebody got sick or was down on their luck or whatever, the local town, the local community, usually the local church, pitched in and helped that person out because they knew that person personally. They knew what his needs or her needs were. Mm-hmm. And it would be great if we could get back to that.
Last two questions I have for you. So Andrew Yang, while he was still a candidate, talked about an idea in which the government would subsidize moving costs for Americans. As in, like, if you're someone who's stuck in a city and your cost of living is way too high, or if you're someone stuck in a rural town and you can't find a job in your local area, well, if you got a job offer on the other side of the country that would pay you more, you would be able to be more productive, you would contribute more to your society, and that his argument was that especially for heads of household, when it's really hard to uproot, it's really hard to sell your house, or end your rental contract, have your wife transfer her work, pull the kids out of school and move them to the other side of the country. Do you think there is room for some government intervention in terms of...
Again, not at the federal level. Too much graft and corruption. If you could bring it down to the county level, and possibly you would help the person or the family out, but it would be like a loan. In other words, they would have to pay it back. There has to be some degree of responsibility behind it. Because if you're just giving money willy-nilly, people are going to abuse the program. They will. It's human nature. I will tell you something. Yes, I'm conservative, but if something's free, I'll be the first dang person online. It's human nature. So if they establish a program maybe at the county level where they loan the family the money and expect it to get paid back at a very low interest rate, 2% or something, fine. I can see that working.
Interesting. Last question I have for you. In terms of what you were talking about earlier, in terms of like what you see as the best solution to beginning to fix our broken healthcare system, you mentioned free enterprise and the markets. Do you see companies like Walmart expanding their business to include basic medical clinic services, checkups, eye exams, ear exams. Do you see that as a potential solution as we head towards
private enterprise, if they wish to go in that direction, that's their decision, because they're free to succeed or free to fail. That's free enterprise.
Thank you so much for sharing your perspective with us.
Thank you very much. Appreciate it, Graham.